Okay, welcome everyone. We're just waiting for a few more attendees. They're coming in. We'll give it about 30 seconds and then we'll begin. And Laura, I'll turn it over to you in about 30 seconds.
Thank you very much.
So I see the number going up, which is good. T-minus 10, Laura?
T-minus 5.
T-minus 5? Okay. All right, I guess take it away.
All right. Thank you all for being here today. We know everybody's time is valuable, so if we can, let us begin today's webinar with a little bit of administrative housekeeping. Number one, all attendees are on mute. If you would just double check when you come in. A PDF of this presentation and a link to the recording will be sent to everyone who is registered. Today's presentation will last about an hour and there will be plenty of time for Q&A. If we do go over, all information will be available in the link to the recording that is sent to you. For Q&A, there is a questions tab and a chat tab. If you have a question, put it in either of those tabs and we will get to those at the end of the presentation. I am your moderator, Laura Casey. I'm an account manager here with ComplyAssistant. My background involves hospital systems, industrial automation, managed services providers, and most recently, cybersecurity. A little introduction on today's panelists, which most of you know: Jerry Blass, President and CEO of ComplyAssistant. Jerry, I'm sorry, did you want to speak, Jerry?
No. Continue.
Okay. Well, first stumbling block of the day. So Jerry currently chairs the New Jersey HIMSS Privacy, Security, and Compliance Committee and participates in events in the national and local chapters. He writes on healthcare and compliance for various publications and is an active contributor, speaker, and member with multiple industry associations. Ken Ryer, Vice President of Operations here at ComplyAssistant. Ken has 17 years consulting and management in healthcare. His prior work includes revenue cycle, finance, corporate compliance, and auditing. Ken is also a contributor to publications and is affiliated with HIMSS local and national, as well as NAJAMA and many others. Donna Grendel, CHPC from Cardon. As founder and CEO of Cardon, Donna's experience is on privacy and security programs for her clients, with a particular focus on those that are HIPAA, HIPAA compliant. Donna is an influential force in the industry, as well as serving on the 405D task force. She's an active member and sponsor of many healthcare and compliance related groups, included HIMSS, HCCA, and many others. For clarification, both Donna and Jerry are 405D task group members. Their opinions are their own and do not represent the opinions of the HHS 405D task group. With that clarified, I would like to bring Jerry Blass back in, President and CEO of ComplyAssistant. Welcome, Jerry. Thanks for being here today.
Okay, Laura, thank you very much. We'd like to start with a polling question number one. We have two polling questions. This is the first one. How familiar are you with the task group and the Health Industry Cybersecurity Practices, HICP? So let me bring up that poll. And you should be able, let me launch the poll. There you go. So you can all answer that. I see the percentages coming in. Looks like we are just about there. Just want to close it. And let's see. Share results. Okay, so we have 32% that have never heard of it. 58% are aware of it, which is great, but never used it. 11% use some of the tools and or guidance before. And it kind of makes sense that we're at 0% right now on using it regularly because it is kind of new. So thank you very much for that. And I will now hide the results and continue. So the mission statement. This is really a great mission statement to the point where I just basically feel like I have to just read it because it is really stating exactly what this is all about. So the mission is to enhance cybersecurity, align industry approaches by developing a common set of voluntary, consensus-based, and industry-led guidelines, practices, methodologies, procedures, and processes that healthcare organizations can use to enhance cybersecurity. So basically, it is setting standards. So we'll go to this slide. So this program, as you can see, has excellent collaboration. And that's why it is where it is today. It really just began in 2017 with the task group. And they made fast progress, even through the pandemic. A lot of things were accomplished. But you could see that there's 230 plus members, and you can see where they're all from, public and private industry. So they involve information security officers, medical professionals, privacy experts, and industry leaders. So imagine that kind of a dream team coming together to put this together. It's a great thing. So what the task group realized from the outset was it was really not feasible to address every challenge, every cybersecurity challenge. So the goal was significantly moving the needle, cybersecurity needle, for a broad range of organizations within the healthcare industry. So the task group looked at which 5 threats, they wanted to pick 5 in today's world of cyber, when addressed, would be most effective in reducing cyber risk. The thing to note is it's the top 5 current. So that means it could be subject to change over time as things change. But currently they are, as you see, ransomware, email phishing, loss or theft of equipment or data, insider accidental or intentional data loss, and attacks against connected medical devices. And you'll see how that comes into play with the concept of not just protecting PHI, but also protecting patient safety and patient care. So the publication, which is the what they call the cornerstone, you can see on this document here, is comprised of a number of documents. First of all, there's the main document, and then there's 2 technical volumes. So the main document summarizes the 5 top threats and also identifies the 10 recommended security practices, also known as RSPs. You hear RSPs, recognized security practices, and summarizes those in the main document, so you get an understanding right up front. And then there's detailed drill down on technical volumes. The first one is for small organizations like practices. And the second one, volume 2, is for medium and large healthcare organizations. Okay, we'll go to the next slide here. Some key bullets about HICP. In real estate, they call it location, location, location. In HICP, it's NIST, CSF, NIST, CSF, NIST, CSF. Everything is NIST. And the great thing about that is that, so many healthcare organizations are already following NIST, along with HIPAA, that it could very well be that you'll find that you already have a great jump start if you're already following this CSF. And you can see that the bullets above kind of indicate that it's not regulation-based approach to security, and we'll talk more about that as well. Okay, so the key objectives of HICP. First of all, it is vetted, and it was vetted by those 230 plus experts. It is cost effective, and it's cost effective for any size organization, even the small organizations. There's a big focus on patient safety and care, as I mentioned. I'm talking about medical devices. And I'm sure many of you have heard of incidents that have occurred. Some large health systems that were down for 30 plus days, maybe even longer, when their business continuity plan covers maybe 72 hours. Well, they went well beyond that. And they had to actually divert patients, chemo and dialysis, and maybe the ICU had to be shut down, and maybe electives had to be shut. So there's all major impact on a ransomware attack. And you know, the results that we're seeing today is it's not just PHI anymore. It is definitely patient safety and care. And HICP is all about that. It's also raising awareness for executives. So it's something that really would be easy communication for executive awareness. The fact that it's consistent means that it has standards, and it does. So it isn't like you have to go into an organization and try to scope NIST or scope another framework. It's already scoped, and you know that makes it. We're going to talk about cookbook type thing in a second. So it does. So I love this slide because, you know, it's a recipe, and the recipe on this slide is for email phishing. So for each of the threats that we talked about, there are the RSPs, the recommended security practices. And in this case, what it's illustrating is if you were looking at this as like a cookbook, you have for mitigating email phishing, you can see the recipe: 5 ounces of basic email protection controls, a dash of multi-factor authentication, 2 cups of workforce education, 1 cup of incident response plays, 1 teaspoon of digital signatures for authenticity, and advanced and general tooling to taste. And you preheat, you let it sit, and the bottom line is it's the skill of the cook is what makes the dish. So that's a great slide. So as I mentioned in the beginning, the program continues to develop, and you can see that here. There's a number of publications and resources that are available that are going to be following that development, reporting on it, so that everyone can stay on top of the latest and greatest. And we do provide links at the end of this presentation to all of the resources and publications. One of the words that we like the most is voluntary, and it's in here a couple of times. So if there's one thing you're going to walk away from this knowing is that this HICP, Health Industry Cybersecurity Practices, is voluntary, and that's what brings in the carrot versus the stick concept. And what I like about it is, well, up to now, it's always been mandatory stuff that has to be done, and if you don't do it and you have a breach, or you know, you get heavily penalized, and you maybe you're showing negligence. This is of a more positive frame of mind, and in the fact that it is voluntary, and that if you do it, you follow it, and you know you have an incident. Donna Grindle's going to talk about what happens then. So I'm going to turn it over to Donna, and we have polling question number 2. So I'm going to let's see, I'm going to bring that up. I'm going to launch the poll, and you can see it there. So go ahead and vote. Okay, I'm going to close it, and I'm going to share the results. All right, so never heard of it. So we have a good percentage that has never heard of it. So that's something good because you're hearing about it today. 44%, the same number, are aware of it but have not looked into it. That's also good for today because you're learning. 13% have looked into it but have not taken any action, and the rest kind of makes sense again, being new. That's 0% on having added it for this year, which, is still plenty of time to do, and then already have it in place. That would kind of potentially happen if you're following this CSF already, as I mentioned before. So I'm going to hide the results now, and I'm going to turn it over to Donna.
Thanks, Jerry. I am very excited to join you, and I'm one of those nerds that gets excited about things like a new law, a new amendment, especially one that is voluntary, as we like to talk about. But the text of this new law that came through, it was signed January 5th. It's officially now public law number 116-321 for those of you who like to reference those kind of things. I'm sure everybody wants to know that. But it does amend the HITECH Act to require the Secretary of Health and Human Services to consider certain recognized security practices of covered entities and business associates if they're making certain determinations and for other purposes. And then it goes into those. So that's great news is if you can take this into consideration, HHS, but what's the value to you? So let's roll, Jerry. It says basically if you can prove that you've been following these recognized security practices, which it does define, for the previous 12 months, they're going to take it into consideration for things like audits and enforcement. That's great news because it can mitigate the fines for violations. It can result in early favorable termination of a high-tech random audit, which they haven't done a great deal of, but for the last couple of years, they've been saying that they're going to get back to that. So that's great news. And then mitigate conditions in proposed resolution agreements. All of those are basically related to enforcement. So they need to give you the ability for them to take that into consideration. And that was great news when I was reading it. So then I'm like, fine, what is recognized security practices one may want to know so that I could take advantage of this new opportunity. I feel certain that Jerry's about to hop over to the next slide so that we can talk about what that is. Oop, overshot. There we go. So the standards, guidelines, best practices, methodologies, procedures, and processes developed under, that's what the law says, but basically it's the NIST cybersecurity framework and the HHS 405D program approaches, which is what Jerry just took you through. The NIST cybersecurity framework is built for recommendations of cybersecurity in the 16 critical infrastructure industries, of which healthcare is one of them. But due to all of the HIPAA requirements and other things, there's not been a lot of push to have it in the healthcare industry. The HICP 405D guides and a lot of the tools that are being published by the 405D task group fall under this, though. And the best part of it is those two are specifically named in the law. So there's none of this guessing about some things. Now, it does say there are other programs and processes that could apply. But immediately I talked to my lawyer friends and I'm like, okay, which one should we do? And they're like, if you're going to do something that's right there in the law, it keeps me from having to argue whether or not something applies first. So there are plenty of folks that pick and choose those things. You can go back forward, Jerry. And then to the next one.
Okay.
Best news ever. It's completely voluntary, though. So it's not like you have to add this to the new amendment into what you're dealing with. However, you get bonus points if you can add it in. It's one of those things that you are free to decide, but it's well worth it. It's kind of like the parents who are like, choices and consequences, kids. So it gives you a little bit of a cherry on top to make your program look even better if anybody's looking. And that's a very valuable thing in today's world, because not only is HHS looking, but investors are looking, and your insurance uh, providers are looking, and business partners. And if you're a business associate, your upstream is looking, and everybody wants to know now, are you making these efforts? And this is a great way to be able to show it, is that you're going above and beyond. But again, voluntary is what makes it unique into our environment, especially. And that means, next slide, we get to the whole thing of it provides an incentive to follow these recognized security practices. And you finally get to the carrot of the whole thing versus the stick. So I'm not going to make you do this, but if you do it, it'll be worth it in the end. Now, the key issue here is to make sure that you have to prove you have been following them the previous 12 months. So the sooner you get started in proving that, the sooner you get to that 12-month clock. And if you have been following any of them and have that documented, you're already ahead of the game, and you can start making that documentation featured, if you will, and just kind of retool it so that it's applying to these things. Now, I highly recommend to folks that they look at a minimum using the HICCUP tools, and potentially take the HICCUP tools and add in a few little pieces of the NIST cybersecurity framework that might apply. But if you can begin doing that today, that's the thing that'll get you in that position to wave your carrot around while they're holding the stick. And I'm excited about it. Go with the nerdy thing, and recognize security practices is a great deal of easy recipes, as Jerry showed you. If you use the HICCUP tool, it gives you the recipes you need to implement NIST cybersecurity framework specifically in a healthcare environment in a specific manner based on your size and complexity. So it's a great opportunity for everybody all the way around, and particularly when it comes to protecting patient privacy and security, which is the ultimate goal after all. So thank you, Jerry. And I think I have done my song and dance.
Okay, thanks, Donna. So just to talk about how we got here, and the HIPAA security rule, as we know, has not really been updated that much since its effective date back in around 2004, 2005 timeframe. We did have the omnibus final rule for high tech in 2013, but that didn't necessarily impact too much about the standards and implementation specifications under the HIPAA security rule. And so compliance is not just security, it is simply the bare minimum. And it's the bare minimum you should do. Over the past 16 years since HIPAA, well, over the past 16 years in general, obviously a number of important changes took place. So meaningful use, of course, resulted in the transition to electronic PHI and interoperability, introducing more locations of PHI electronically, and the attestations for the security part of it. In some cases, I think we all know, in some cases were more like checking off 20 check boxes and attesting. So the attackers knew that there were vulnerabilities created by this. And for the rest of the bullets, the same thing. I already mentioned more locations. So we had the EMRs, the portable devices, HIEs, APIs, IoTs. We had, with the pandemic, the remote workforce and telehealth explosion. And then, of course, an increase in third-party vendor breaches recently, like SolarWinds and others. And the I guess it's the Cures Act or the CARES Act. I think it's CURES, Information Blocking Rule implementation is beginning, and interoperability is coming next. But with information blocking, you do have, you know, more vulnerabilities. You do have the need for looking at privacy and security exceptions, and that's another whole subject matter that, again, all of those bullets add up to more vulnerability, more motivation for bad actors, and increase in attacks. And I've heard that over the next 3 to 6 months, you know, we could see 3 times as many attacks. And we're already seeing them, you know, happening all the time now, and it's getting real scary. So yes, risk evolves at a blazingly fast pace, and motivation, again, continues to increase as long as there is money to be made. Bottom line is that any organization can become a victim of any of these threats at any given moment. No one is immune. Recently heard that, you know, these bad actors are not like your like a 10-year-old kid in the basement of his grandmother's house in Brooklyn. These are organizations that hire very expensive folks that are very smart, like PhDs, and even healthcare organizations that implement great controls. These bad actors are trained to find gaps and somehow get in. And we know the biggest ways they get in, which is, you know, the human element, which are the phishing attacks. That's, you know, one of the most common ways that they get in and you know, start the ransomware. Okay, so HIPAA and NIST, it's a logical combination to modernize the HIPAA security rule. And the CSF normally requires scoping, as I mentioned before, but with this program, the 405D HICP, we've already talked about the fact that it really comes pre-scoped, like the cookbook recipe for small, medium, and large organizations, and helps organizations implement the recognized security practices with guidance, tools, and training. So Donna, would you like to take over the discussing the threats and the practices from here?
Well, I would be happy to do that for you.
Okay.
So the 5 threats that the task force worked in many debates to narrow it down to are email phishing attacks, which we know is a huge problem. Everybody talks about it. It's not just a healthcare problem. It is a global problem because that's a very handy way that the criminals use, and it kind of falls in line with they've expanded from that into more what they're calling social engineering, but it all has the same goal. So email phishing is a big piece. Ransomware attacks, again, not a healthcare only problem, but healthcare has had the largest increase of ransomware attacks in 2020, and it is not letting up, I can assure you, in 2021. Then we get to loss or theft of equipment or data, which this, prior to the expansion of phishing and criminal gangs being involved in ransomware and those kind of things, it was the #1 loss of healthcare data, and we still don't have it completely out of the list. So that tells you it's a constant problem that we sometimes lose focus on, and we have to keep up to date on it. And then internal, accidental, or intentional data loss. This is what we often narrow down to just say insider issues, whether it's a malicious intent or an accidental case. Usually, you're going to have an insider falling for a phishing attack that gets you the ransomware where you lose the data. And then the final piece is the attacks against connected medical devices that could impact patient safety. And this whole process that the 405D task force is going through is trying to remember This ultimately is about patient care. And if we can impact patient safety in any way, it needs to be in a positive way. So we added the medical devices, and there's other, every time you turn around, there's a new thing being connected to the network that could impact the network itself or the device's ability to deliver adequate diagnostic information. So those are the top 5 threats. And after that, then we go through if we're going to focus on correcting or managing and mitigating the damage of those top 5 threats. Here are the 10 practices that would do that. Is you have email protection systems in place, endpoint protection systems, meaning the actual devices that are connected to the network, access management. Again, this is a normal process that every industry should go through, is the concept of I only have access to the things I need in order to do my job. The more I have access to, the more likely things can go wrong with things I shouldn't even have had in the first place. Data loss prevention, watching for the things sneaking out the door. Asset management, if I don't know what I have to protect, then how can I protect it and keep up with it? Network management, keeping all of the vulnerabilities down and knowing when someone that shouldn't be there comes into the network. Vulnerability management, every day now there is an announcement about a security update, whether it's Windows or the firmware on devices that need to be updated, firewalls. It's just constant, and if you don't stay on top of it, for example, the Equifax breach was because of a unpatched vulnerability. SolarWinds, the recent Kaseya one, those all deal with unpatched vulnerabilities. And most every study out there says that the best way to be to mitigate the impact of an attack, because you're never going to be in a position where you can say we're not going to be attacked. You have to have a incident response plan that isn't, hey, I'm going to call Jerry. That is not the plan. That is, let's count on, that single point of failure yet again. What if I can't get Jerry? You have to have a full laid out plan where people know what to do and who to call in various situations. Medical device security, well, that kind of goes in play because for years people kind of overlooked those. And now we're learning more and more how important it is. And then actually having written cybersecurity policies. And while this doesn't cross-reference to HIPAA itself, these are all things that are in HIPAA. So you get a twofer by following these guidelines. And then the sizing, there's actually a matrix that we're actively refining these days for our update that's coming out hopefully later this year, if not the beginning of 2022, where you've utilized the matrix to determine what technical volume to use in your situation. So it's based on, the investment and the size and complexity and all of those kinds of things. But even if you calculate on there, let's see, I fall in the small category, it doesn't mean you can't use medium. And if you fall into medium, it doesn't mean you can't use some of the small to fill gaps as you build into the medium. And if you have absolutely nothing in place and you're of any size, you can use the small to get up and running. So there's a lot of ways to use that cross-reference, but you also, again, it's all voluntary and it's designed for you to adapt to your environment.
Okay, so Donna, I'll take this one.
Well, you have fun with that now.
Yeah. So to summarize, what we covered today, some takeaways. We talked about cyber safety is patient safety, and it's not just IT or compliance. It's enterprise. It's everyone's concern. So a multidisciplinary team is needed, comprised of department heads and leadership. Everyone needs to be involved in understanding where they stand, where do they have gaps, where do they have risk, what do we do if we have an attack that extends our downtime. It all, needs to be across the board. We talked about how there's going to be continual development from the task group, and they're working currently on governance policies and procedures, which would then come into play to follow for enterprise-wide oversight, and overall governance and oversight. And again, we've said it probably 90 times already, but it's voluntary, incentive-based, unlike HIPAA, the carrot versus the stick. And it recognizes that no organization is perfect or immune to attack, and gives credit for being able to demonstrate due diligence. Whole different approach. We promised you some resources and links, so everyone's going to get, as Laura mentioned, the PDF of this PowerPoint and the recording link. And so this information you'll be able to go out and look at all the information that's provided by the task group that we've talked about already today. Again, here's more. And so Donna, why don't you take a second to talk about your Help Me with HIPAA?
The Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun.
Yes, that one.
That's our weekly podcast, and you can go to any podcasting app. You can listen on the web, but we've been out there. We just hit 6 years and 300 episodes. There is seriously a chance that if there's a question you have about any of these kinds of things, we may have covered it. If not, you're free to send us a suggestion, and then we do an episode on it. But it's great fun, and you can utilize the links and cross references we have there. And we're always updating them and discussing the 405D and recognized security practices, as well as other HIPAA things, because clearly we're there to help you with HIPAA.
Great. Okay, so now what we're going to do is take a look at a risk register. It happens to be our risk register in our platform, and Ken Ryer is going to take you through these.
Yeah, thanks, Jerry. So risk register is a new function in our platform, and we built it for organizations to make sure they had a way to demonstrate what they're doing now, as opposed to just going through a risk assessment and documenting gaps and then going back to mitigate those gaps. So this is a picture of our dashboard here, and you can see we've detailed a risk map, and the threats would go below them. So you can easily identify the high impact and likelihood threats by clicking on the box there, and then sort it down below in order to manage it properly. So next slide, Jerry. So we've broken it down really into 6 steps here for collecting and assessing risk across an organization. I'll go through these quickly, and then we'll break it down with a screenshot on each one of the slides coming up. But identify and inventory all the threats, as we've gone through the presentation today for HICP. We have included all HICP threats, so the 5 threats identified there, as well as their corresponding controls for small, medium, and large organizations. And we also have an internal threat library that can be used by anyone who has our product. We've compiled a list of 125 other threats that may impact an organization, and you can detail controls around them as well. Number 2 is assess risk level based on impact and likelihood. So we're talking about inherent risk, how the risk is inherently impacting an organization. Choose how best to address each one of the risks. So these are plans that you can choose: avoid, control, transfer, and accept. Number 4 is determine residual risk. This would be based on your active controls that you have in place in order to mitigate the threat. Determine maturity level. So we have 3 maturity levels here. Each one has 5 stages you could work through. And then last one is assign an action plan. So any gaps that are found as you go through this, you can assign action plans to members of the organization. Next slide. Here we're going to talk about number 1 and 2, identify and inventory all threats. If you are familiar with HICP, you should know the 5 threats that are being displayed here. On the left are the 5 HICP threats. And if you scroll over to the middle there, you'll see the inherent risk column. That's where we would assign inherent risk levels for each one of the threats. And then on the dashboard, this would display below the graph we showed on our landing page a few slides ago. So next page, next slide. So choose how best to address each risk. So I mentioned before, we have different plans that you can choose. I really want to talk about control with those plans, but avoid and accept are pretty self-explanatory. And then we have transfer to a third party. So if you do have any of the controls in place that are detailed out to a third party, you can notate the third party as well. But if you do happen to choose control under the plan area, you can then add different controls from HICP. So within our control library, you can choose whether you're a small, medium, or large organization. Bring those controls in and then toggle them on and off, as you can see the green icon there next to the control. So each one of the controls that you put on has a corresponding reduction value. And then at the end, as you work through this, you want to lower that inherent risk by the reduction value for each one and come up with a residual risk, which is shown on the top right of the screenshot there. And any gaps that you have, you can assign action items to them. So making sure that you cover all of them. Next one, please. 5 and 6, determine maturity level. So we have documentation level, training level, incident response level. Each one of these has 5 stages, which you can detail around your threat and control that you have in place. And then assign an action plan. As mentioned before, any gaps that are found around the controls that you may want to put in place but don't have them in place yet, you can assign them out to different members of the organization to implement them for you. And with that, I'm going to turn it back over to Laura with the next slide, and she'll take you to the questions.
Thanks, Ken. We do have a few questions that have been sent straight to me, and let's go through this. I'm going to combine 2 questions into one. The question is, when does the clock start on the 12 months, and does development time count towards the total? Who would like to take that? Jerry?
Yeah, sure. So turns out that the OCR has not yet provided guidance. They intend to provide guidance, but they have not provided guidance yet on how they will determine when the 12 months start. The statute says that you must be able to show you have been following the practices. And until we have further guidance, we tell folks that they should document the whole process once they actually start doing anything, including planning. And even if they don't count it as part of the 12 months, it will likely be accepted as intent. And that gets down to other folks like lawyers figuring things out if needed to determine if the 12 months have been met. And again, getting back to what we said before, if you have been following this CSF, it's very likely that you may have already made progress, that you will see that you have made progress as you begin to go through this process. So there's no black and white answer. It still remains to be heard from the OCR at this point.
Okay, thanks. The next question is, I have heard this described as safe harbor. Is that true? What is the chance of a guarantee?
I'll take it.
Oh, thanks, Donna.
That one, I and myself thought, hey, this is a nice little safe harbor. But then my lawyer friends explained to me a safe harbor means that it comes with a guarantee, and that this does not come with a guarantee. So what it says is that HHS must take it into consideration, but it doesn't say what they have to do with that consideration. So they have to include it in their decision-making process, but it doesn't mean that because I can prove this, I don't have to worry about it, which is similar. Like if I can prove that I have an encrypted hard drive on a stolen laptop, then it's not considered a breach. That's a true safe harbor. I have to prove that I'm following these things so that I can have them take it into consideration. But I think they'll end up having to do this on a case by case basis as far as how much it will mitigate any of these fines or penalties or settlements, and what it would require to get that favorable exit on an audit.
All right. Thank you very much. All right. The last one I'm going to do is actually, I'm rolling two into one again. Thank you all for all your questions. The risk register, is this customizable? Can risks or controls be added? And they do it off of a Google sheet, and they include areas that are currently outside of HICP. Ken?
Yeah, thanks. Yeah, I could take that one. Thanks. So yeah, we did talk about what's included in the software out of the box, and we do have the HICP threats and control libraries in place, as well as one that we've created with 125 threats. You can also bring your own in, so we can assist with that, or you can create them in the product for management, and that's threats as well as corresponding controls. So yes, you can do that.
Thank you. That's all the questions that have been sent to me.
Yeah. Yeah, Laura, I just wanted to mention, thanks for moderating all this. And we do have a survey that everyone will get as soon as this webinar ends, so you can answer a survey. And thank you for doing that. And so, Laura, if you just want to wrap it up, I think we're pretty much done.
Well, if there are no further questions, I would just want to remind everybody that you will receive a PDF and a link to the webinar. And again, in the PDF, there's going to be contact information for Jerry, Ken, and Donna, as well as myself. And if you have any further questions, we would be more than happy to answer them for you. Other than that, I'd like to say thank you very much for joining us today. And thank you, Donna, for helping us out.
Anytime.
Anytime.
Okay, thanks everyone.
And thanks.